let us take a look at sympathetic nervous system. We know that when sympathetic nervous system is activated, the body's fight action uh, uh, response of the body comes into the picture. The heart rate increases, the pupils dilate, it inhibits digestion and releases adrenaline and non-adrenaline. I've mentioned this in order to let you know that the sympathetic nervous system has got branches which have an effect on every system of the body. Now, I want you, all of us, to go back to the example that we took for physical activity. We said when a particular person is exercising, is involved in any kind of physical activity, we saw what is happening at the chemoreceptor level. We spoke about that imbalance. But we also said that along with an alteration or an increase in the respiratory rate, we seem to have the person in not in his comfort zone. We see him little anxious, more perspiring more. Maybe his heart rate is high. So that is now your sympathetic nervous system. When your chemoreceptors sense that there is an imbalance in the CO2 and the pH, they not only activate your pneumotaxic center or your DRG, it also activates your nucleus tractus solitarius. It takes impulses from the periphery, takes it via the vagus nerve and brings it to the nucleus tractus solitarius, the central processing unit. The nucleus tractus solitarius is going to activate the parasympathetic nervous system, okay, and eventually try to is going to activate the sympathetic nervous system here, because it is going to help you increase in the heart rate. Now you relate that when the heart rate increases, the myocardial contractility also increases. When the myocardial contractility increases, it supplies more and more blood. Because the cardiac output is increased, it is going to supply the blood in the entire body, and the oxygen requirement of the muscle is being met. Okay, so the chemoreceptors are going to function in two ways. One, by activating your pneumotaxic center, and secondly, by also increasing the heart rate by activation of sympathetic nervous system. So in a scenario like this, your sympathetic nervous system has come to help the body. Okay. Now, let us take the example of the parasympathetic nervous system. The parasympathetic nervous system is the system that is the one which takes you to healing, to recovery. Okay. With activation of parasympathetic nervous system, the heart rate decreases, pupils constrict, it stimulates digestion and promotes relaxation and recovery. Now, here, let us take the example of intervening slow breathing exercises to that particular patient who was exercising. So the moment you introduce these breathing exercises in a patient, or you try to modulate the person's breathing, try to calm him down, slow down his breathing, two things, this parasympathetic nervous system is activated by two mechanisms. Firstly, the hyperinflation which was happening because the person was there was an increased respiratory rate, he was probably trying to hyperventilate, that is being settled down because you have intervened with slow breathing exercises. So the constant stretch or activation which was done by the pulmonary stretch receptors, and those signals were reaching the pneumotaxic center and the nucleus tractus solitarius, is now stopped. So the constant activation of sympathetic nervous system is inhibited. First thing. Secondly, by slowing the breathing, the chemical imbalance is also getting corrected. The body's oxygen demand is reduced. The carbon dioxide expulsion, now the oxygen carbon dioxide levels have started come to normal. There's a balance now, and now the activation of chemoreceptors is also reduced. So the chemoreceptors which were trying to increase the heart rate have now inhibited. So over and over, the sympathetic nervous system is now inhibited and the parasympathetic nervous system has come into the picture. Thus, the heart rate is reducing, taking your patient towards the recovery. Okay. So with sympathetic and parasympathetic nervous system, I've tried to tell you how breathing modulation have auto-tuned the heart rate and the respiratory rate. Now, we have been speaking about these loops. We spoke about chemoreceptors. We spoke about pulmonary receptors. These two were the receptors for the respiratory system. Now, along with these two, let us talk about the sensory receptors of the heart. which are your baroreceptors. So these baroreceptors are basically the gatekeepers of cardiovascular stability. Okay, they are mechanoreceptors located in the carotid and the aortic arch. These are mechanoreceptors, I said, they are responsible for measuring the arterial wall stretch. We know that blood pressure is the pressure that is exerted on the walls of the arteries. So any modulation in the blood pressure, these baroreceptors are going to catch it. So let us have here, I have an example that when the blood pressure increases, these baroreceptors are stimulated. They carry these impulses again from the periphery, that is carotid and the aortic arch. They take it via the vagal nerve and the glossopharyngeal nerve to the nucleus tractus solitarius, the CPU, I said. And there it is going to activate the parasympathetic nervous system. Okay. So when your parasympathetic nervous system is activated, the heart rate reduces. When the heart rate reduces, the cardiac output and the stroke volume also reduce. The arteries dilate, so the blood pressure decreases. Right. So this is about activation of the parasympathetic nervous system. So you will understand this is the entire baroreflex. Okay, activation from the getting activated from high blood pressures to the activation of parasympathetic nervous system. This is called as a baroreflex. Now, this baroreflex stands as a very, very strong reflector of your cardiac health, and any imbalances or any poor baroreflex sensitivity is a major cause for any cardio-related disorders. May it be hypertension or may it be any other cardiac condition. So this baroreflex sensitivity remains a mainstay for your cardiac health. And there are so many articles and so much of research available which is stated that breathing exercises are extremely helpful in improving this baroreflex sensitivity. Okay. So you will realize that since we spoke about chemoreceptors, baroreceptors, we have spoken about a term nucleus tractus solitarius again and again. Okay, because it is a relay center. It actually gets impulses from both baro as well as chemoreceptors. So coming to this nucleus tractus solitarius. This nucleus tractus solitarius is located in the dorsal medulla of the brainstem. Okay, it acts as the primary relay center for afferent signals from both baro and chemoreceptors, thus from cardio and respiratory system respectively. Okay, so sensory inputs from carotid and aortic arch are brought via the vagal and the glossopharyngeal nerve, which terminate in this nucleus tractus solitarius, and further integration or further processing of the whatever response to be taken is decided at this nucleus tractus solitarius. Okay, this nucleus has got various small other downstream centers like the dorsal motor nucleus of vagus, the nucleus ambiguus, the rostral ventrolateral medulla, and many more, which help in modulating the sympathetic and the parasympathetic output. Okay, so basically this NTS, this nucleus tractus, is like that auto tune. Okay, it tries to tune in the heart and the lung response according to the physiological demands of the body. Fine. So this is, and if you will understand that the location of this nucleus tractus is very close by to the dorsal respiratory and the pneumotaxic center. Okay, so it relays all the information that is being bought by the receptors. Hence, now the loop is completed. Okay, we have got an idea of the neurocircuitry pathway also. Now, we've been talking a lot about breathing and blood pressure and heart rate. Fine. We have understood this much that respiration will have an effect on heart rate as well as on the blood pressure. Okay, so these two are very, very closely associated with ventilation, and that is what is your respiratory sinus arrhythmia. Okay, do not go on the term, it is named accordingly. Okay, but we know all this, that when a person is breathing in, the heart rate increases, and when a person exhales, the heart rate reduces. Thus, your respiratory sinus arrhythmia. So we have already learned about the entire mechanism of breathing, the activation. But we'll just see how this works. So when a person inhales, inspiration takes place, diaphragm contracts, moves downwards, chest cavity expands, the intrathoracic pressure is lowered. Okay, so the air flows in. The pulmonary stretch receptors are stimulated. Okay, they are sending because there is an inflammation in inflation at that point of time while inhalation. First thing. Secondly, your baroreceptors are also activated because there is an artery, the increase in the blood flow is going to cause increase in the arterial wall stretch. This is going to go by the vagal nerve and the glossopharyngeal nerve to the nucleus tractus solitarius and is going to activate the sympathetic nervous system. Thus, the heart rate is going to increase. A temporary rise in the heart rate. Okay. Whereas exactly opposite during the exhalation, while the initiation of exhalation, the diaphragm is going to go back to its original position. The chest cavity is going to reduce. The air intrathoracic pressure is high, so the air is going to flow out. Thus, the activation which was on the baroreceptors as well as the pulmonary stretch receptors is going to get deactivated, and the stimulus to the sympathetic nervous system is going to suppress. Thus, the activation of parasympathetic nervous system and the heart rate is reducing. Fine. So all in all, we have understood that with every breath that you take, the heart rate, the blood pressure, the autonomic nervous system, the action that is going to be taken by the autonomic nervous system is going to change. This was all very fine till the breathing was going good. But what exactly happens when the breathing goes wrong? Okay. I've said hyperventilation here, but I would also say any kind of dysfunctional breathing. Okay. Rapid shallow breaths by the patient is basically dysfunctional breathing. When the patient is not breathing correctly, not breathing optimally, it is a dysfunctional breathing. Again, a mainstay of lot many conditions. Not only it is common in patients with respiratory dysfunction, but also common in patients with chronic long-term illnesses. Okay. So here the body's respiratory rate and depth both are increased, right? This disruption severely affects your autonomic nervous system, and we have known it why. Okay. Now, when the rate is only high and when the depth is also affected, in both the situations, your carbon dioxide of CO2 is washed out more, okay, leading to a decrease in the CO2 level, the arterial CO2, and hence a lot of autonomic reactions are activated. Again, your chemoreceptor sense this reduction in the CO2. Again, there is a pH imbalance, and this chemoreceptors are going to activate your brainstem, and the respiratory drive is going to change accordingly. The respiratory drive is going to decrease. Okay. Then nucleus tractus solitarius is going to come into the picture. It is going to activate your sympathetic nervous system, and your patient is going to show you signs of anxiety, anxiousness, increase in heart rate, and so on and so forth. Okay. Now we've spoke so much about breathing and heart rate and respiration. So when it comes to clinical application of breathing exercises, now, we as physiotherapists are being trained, are being taught so many breathing exercises, right from diaphragmatic, pursed lip, buteyko, alternate nostrils, resonant, 478, and so many types of breathing exercises. And we have studied, done so much of research on the effectiveness of these exercises on so many parameters. So apart from these exercises having a profound effect on improving the lung volume, lung capacities, helping out in COPD, reducing the medication use, reducing the improvising the saturation. We've seen the effects, so beautiful effects in COVID also. But apart from having an effect on these, they also tend to have a widespread effect on the other side, the cardiovascular and the autonomic parameters. We have seen the effect of breathing exercises on hypertension, sleep quality, stress, physical activity, maybe VO2 max, and so on. So on. We can go on for so long on this. So here I want to tell you or emphasize that when we are introducing breathing exercises, you choose any kind of breathing exercises. Eventually, you are trying to retrain your patient's breathing. You are trying to introduce the slow breathing into the picture. Okay. You're trying to optimize the patient's slow breathing or correct if there is a dysfunctional breathing present. So Since we spoke about breathing and we all are very well aware of breathing exercises, I would want to emphasize your attention towards something called as heart rate variability. Okay. What we spoke, the integrated physiology of the chemoreceptors, the baroreceptors, the neurocircuitry pathway, the effect of one receptor on the cardiac system, or the effect of baroreceptors on the sympathetic nervous system. This all changing dynamics was nothing but cardiopulmonary coupling. Okay, this cardiopulmonary coupling is an integrated performance of all these two systems with each other. And mind you, your breathing exercises have a profound effect on these cardiopulmonary coupling, on improvising this cardiopulmonary coupling. Okay, coming to the heart rate variability, uh, while speaking about the autonomic nervous system, I did mention that there has to be a balance between sympathetic and parasympathetic nervous system. They should work optimally and together. This heart rate variability is about that balance. It is a marker of the autonomic balance. It is said that with chronic illnesses or with conditions with stress, both internal, external, any stressors, clinical conditions, this heart rate variability is reduced and it calls out for a lot more trouble. Okay, so taking a close look at this heart rate variability is very important. This is a very much measurable entity which can be measured. It gives you an idea about the sympathetic and the parasympathetic nervous system and your heart rate as well as your respiratory rate. Okay, the breathing exercises that we administer, or especially let's say the slow breathing, which is a major component of all our breathing exercises, help in improvising this heart rate variability. Along with improvising the heart rate variability, they are known to improve the baroreflex receptor sensitivity. We spoke it during the baroreflex receptors. Imagine if the baroreceptors are not functioning sufficiently, or the sensitivity of those baroreceptors is affected, it will no longer be able to sense any kind of changes in the arterial wall. Thus, the activation of sympathetic and the parasympathetic nervous system according to the demands is going to get disrupted, and thus the patient or the patient's body will not be able to cope up with the physiological demands of the body, right? So this heart rate variability stands as a very, very important entity. Our breathing exercises that we practice are having an effect, profound effect on everything. But now it's high time that we start moving towards the effect of our breathing exercises on something called as heart rate variability, because it is going to tell us a wider picture of the autonomic nervous system, which is auto tuning between, constantly tuning in between your respiratory and your cardiac system. Okay. So this is to summarize that there are so many breathing exercises. I've just mentioned three, but there are so many. And these exercises, as I said, are mainstay in retraining our breathing patterns, shifting the dominance from sympathetic nervous system to the parasympathetic activation, the one which is responsible for the recovery. So if I have to summarize this entire session for you, breathing is not just ventilation, it's a communication between the lungs and the heart being governed by the brain, a very precise neural control. The chemoreceptors and the baroreceptors act as the body's sensor that constantly fine tune the breathing, the heart rate, and the blood pressure. The autonomic nervous system stands as the bridge. Okay, and the slow controlled breathing can help us shift the balance towards the parasympathetic dominance, improving the recovery and the overall health. Yes, the sinus, as we spoke about the respiratory sinus arrhythmia, and we highlighted about the heart rate variability, which is a very, very measurable window available, which tells you about the autonomic flexibility. Breathing exercises are therapeutic tools, and when exhibited by a skilled physiotherapist, they can influence cardiovascular, respiratory, neurological, psychological, and the overall well-being of an individual. Okay, and a physiotherapist, and I believe that a physiotherapist can conduct this entire heart-brain symphony very well, guiding our patients to breathe better, heal better, and live better. Lastly, every breath is a chance to reset the system. So train it, protect it, and use it very, very wisely. I think that's it. Thank you.
Thank you so much, ma'am. It was a very visually sorry, let me start again. Thank you so much, ma'am. It was a very beautifully put together PPT along with the videos and everything. It makes us understand the topic even better. Thank you so much for that. With this, I would also like to take the opportunity to thank Dr. Parag Sancheti sir, Dr. Ashok Sham sir, and Dr. Mrs. Manisha Sangvi ma'am. Along with that, the technical team of Physio TV, that is Dr. Sona Kolke, Dr. Shivani Chutke, and Dr. Fareen Patel as well. Thank you so much, ma'am, for this, and we would conclude the session here.
Thank you. Thank you so much, Dr. Ria, for so managing this so beautifully. I would also like to thank Sancheti Institute of Orthopaedics and Rehabilitation and Sancheti College of Physiotherapy for giving me this opportunity and having me on the board. It was really a very nice session and experience for me also. I hope I could convey the entire session to all of you, to all the viewers. Thank you so much.
Thank you. Thank you so much, ma'am.